my name is Maya. Welcome to my channel. I'm going to be showing you how I am going to micro needle my face. I've done it once before. This will be my second time. It's been about 2 months since I have done my first micro needling treatment. Today I will be using the Dr. Penn A7 needle. But first I'm going to be numbing my face with this Ebanel Numb 520 lidocaine. It's got 5% lidocaine. My hands are clean, and every time I use my products, I wipe them all down with alcohol right afterwards. How I learned how to microneedle, or the process of it, is by watching Penn skincare. I would highly recommend watching her if you are interested in microneedling your face. If you don't know who she is, I highly recommend watching her. She is an esthetician and she's very knowledgeable. So I'm putting that all over my face, and kind of on my brow bone, and slightly underneath my eye, because I will be tugging the skin down to microneedle in that area as well. I don't have saran wrap. I wish I did, because it takes a while. And I would also put it over your lips, but my lips get so numb. And I'm looking this way because there's a mirror here. And I also have a tendency to get clogged pores under here, so I will be microneedling just below my chin. So the first thing you want to do is clean your face. I just got out of the shower and my face is already clean. And then you want to put on your numbing cream. And this will stay on for about, I would say like 20 minutes, depending on how quickly or slowly you become numb. So for the rest of my face, it takes a really long time. My lips are already feeling numb. So yeah, I will be leaving that on for some time, and then I will be back when I'm ready to microneedle. Before I go, I do want to say that I'm going to be using the Cos de Baha hyaluronic acid serum as my medium to make the needle glide better. It looks like this. I also bought this on Penn recommendation. And the only thing I haven't shown you are my needles. Okay, I'm back. I let that lidocaine sit for about 10 to 15 minutes. I washed it off. I'm really numb around this area. And now I washed my face with my cleanser, and then I wiped it off with a clean towel. And I have some alcohol in this dish here. I'm gonna be soaking. So I soaked all of the alcohol that was in here on this pad, and I'm gonna be just wiping my face clean with alcohol. Okay. And I'm going to be spraying my face with the Biologique mist, and then I'm going to be putting on some serums before I microneedle so that they penetrate into my skin. The first time I did this, I didn't put on any serums, but I think that Biologique has some gentle. I am going to be putting some Cos de Baha into this dish that's already cleaned with alcohol. And I cleaned the bottle with alcohol on the outside prior to this. And I'm going to be washing my hands one more time. Okay, so now that I have everything set up, I am going to connect my Dr. Penn A7 needle to here because it doesn't work on its own. And prior to using it, I have already cleaned this with alcohol. I'm just going to show you. You see 0 all the way to 2.5. This is your needle depth. You're going to manipulate it at how far you want to put it with right here. So I'm going to be going to 0.5. First, and I'm going to be doing my forehead, and then here you kind of have like the strength. You have like full strength and then like the least amount of strength. I'm gonna go for now right at the one prior to full, and that's how it sounds. I'm gonna open up a needle, and you have your needle, you have a paper side here. I'm gonna just pop it open at the side where I'm gonna be inserting the needle into here. So through the paper, take your needle, and that way you don't have to touch the needle. And I'm just gonna set this in here for now. And prior to putting the Cos de Baha serum on my face, which I will be putting on with a brush, I'm gonna spritz my face with the Biologique oxygenante mist. It's got good ingredients in it. First time I microneedled my face, I didn't do this, but I kind of want those ingredients in my skin right now. So now that that's done, I'm going to be taking this, and I've also put alcohol on this brush as well. And this has the Cos de Baha serum, and I'm gonna just put it all over my forehead because that's where I will be starting. And I've already put the needle on 0.5, and I'm just taking out the protective plastic here and turning it on with this button, and you can see. I'm just gonna go in lines of 3. So I'm doing vertical, horizontal, and diagonal. And I can't feel the 0.5 on my forehead, and I have pretty sensitive skin, so it doesn't hurt that bad. Okay. Next, I'm gonna do it on my lip area, and I'm gonna keep it at 0.5. Actually, this is a little bit more sensitive. And I'm doing it in the order that Penn Smith Skincare showed in our video. And then I'm gonna go on top of my lip. Underneath a little bit. And over these lines here. I'm actually gonna spray my face to rehydrate. And I'm actually gonna increase it to about 0.75 in this area for a final. And I kind of like doing it in circular motions. Okay. Now I'll be going over my cheekbone area. And I'm putting Cos de Baha and some of that spray. And this is, I'm putting it down to 0.5 over my cheekbones. And I'm gonna be raising it to 0.75 for the bottom of my cheeks. And I'm making sure to go over this dark spot I have on my cheek from old acne. And don't forget this area here. And I will be going underneath now. So now I'll be doing the same thing to the other side of my face. Cos de Baha. And a little bit of this spray. putting it down to 0.5 and going to my cheekbones. I think my cheekbones feel the most sensitive when I do it. I kind of like doing it in circles because I don't have to think about the movements. I can just go. Because it can be a little scary when it's your first or second time microneedling your face. And I truly just want to focus on maintaining the pain. Okay, and then I'm gonna go up to 0.75 for the rest of my cheeks. Don't forget your acne or your acne scars. Don't forget your acne scars and this area by your ear. Okay, I need a little bit more spritz. And I'm going at 0.75 underneath my jaw area because I always get clogged pores there. So now for my nose and my under eyes, I'm going to 0.25 and I'm gonna be putting serum underneath my eye, and I still have the alcohol. I'm gonna use that alcohol pad and pull down on my skin, and I'm not going over this area anymore, so. And I'm pulling my skin taut, and I'm not gonna go over that skin with the needle again. And you want to pull the skin that you're needling over your orbital bone. Okay, and I'm just gonna go over my nose with 0.25. Rehydrate it. And actually, I'm gonna go all the way up to 1 for this area right here where I have the most pores, because for me this is painless, right on the the meat in this area. And I haven't focused on that area much prior to this. Okay, lastly, other eye, and also hydrate. Put this down to 0.25, take the alcohol pad and tug my skin down. You can go to higher depths in other areas, so you could even do like 1 in your chin area, you can do 1.5 in your cheek area. If you can tolerate it, you can try 0.75 in your forehead area. You can even try upwards of like 0.5 in your orbital area, and then like if you can tolerate it, 0.75 in your cheek area. I don't have that many issues to address. I kind of just want to, use microneedling to kind of rejuvenate and make my skin a little bit more plump, healthier, even the texture of my skin. So I'm not interested in going in higher depths. I don't want to cause myself pain. I don't want to irritate my skin. The first time I did it, I did go a bit deeper. I'm just taking the packaging of the needle and then sticking it through the hole I made and twisting it off so that I don't have to touch this. And undoing this, and I'm going to be wiping everything down with alcohol again. So I have my alcohol here, some of the pads I used. So what I was saying before is I did a deeper depth the first time, and my skin looked great. I was way more red and sensitive than I look right now. I made myself bleed in some areas because I wanted to see what that, I'm pretty extreme with my testing. So I wiped everything down, putting it in the sleeve it came in, and this sleeve has stayed in that box. And I normally close this box, but I forgot to do that today. And I'm just putting that back in here with the end of, I meant to put it in this way, with the needle end going inwards, just to have less possible exposure to germs. The next thing I'm gonna do is take the charger and wipe it all down with alcohol as well. After I think the first week, I started to see some irritation and texture marks, and I'm taking this and wiping it all down with alcohol. And I'm putting this away. These were already sealed. And I'm taking more alcohol and just wiping down all of the things I use. So I'm wiping down the Cos de Baha serum again, just the packaging so that everything can stay as clean as possible, as clean as I can maintain. Putting it back in the box it came in. Same with the numbing cream. I have tried microneedling on my mom as well, and I went deeper on her than I did on myself this time around. She bled some, but she loves the results. Her skin is not sensitive at all, and I'm putting it in the box here. So she has healed and her skin is looking smooth and even. I'm wiping down the serum I used, or this mist I used. You don't have to buy this mist. There is a growth factor mist that Penn recommended in one of her videos. She has so many videos on the microneedling. But I'm gonna go wash my hands. I'll be right back. She has so many videos talking about like products she recommends, the protocols and things. But she recommended some EGF serum mist that you can mist on during the procedure as well to keep it hydrated. After the first time I microneedled, I only used the Cos de Baha, and my skin was extremely dry. And when my skin gets dry, my skin gets irritated. So I thought maybe I'd incorporate this, and then I'll put my masque vernix on top. And I don't know the price point of the EGF serum that she recommended, but I think it might be cheaper than the Biologique one, and I totally recommend it. If she's recommending it and it's more affordable than that one, I'd say do it. And so I have to cut this in half because I can't squeeze out any more product. But cream mask vernix is supposed to be gentle enough to use on like after procedures for your skin. So I'm gonna be using this to kind of seal in the moisture, because I don't want to risk my skin being sensitive, and this will kind of like seal in the moisture as well. And it's cold where I live, and I just don't want any sensitivity. So I'm just taking all of that cream out of this with my pinky. And I know this is a lot of cream, but my skin is gonna need it. And this is supposed to help like calm the skin, rejuvenate it, heal it, and it feels so nice. Maybe the next time I do it, I'll go a little deeper. If I have good experience with everything else I put on my skin today, I'll do exactly the same. And then I'll go deeper to see if my skin can handle it. I'm just gonna put some on my neck. And then take whatever's left and just put it on the back of my neck and my chest. And I'm just trying not to tug my skin too much. Oh, just one more spritz. Because my skin does feel quite dry. That's the only thing I don't like about microneedling, is I can't stand the dry feeling afterwards. So this is how my skin looks after this microneedling session. I have not been trained to do this, so I would really recommend you check out Penn Skincare to see her protocols on everything, because she is an esthetician. She does this all the time. She works with a physician who they do medical procedures in the office. That's the skin. And what she said in her video about the protocol is the redness and erythema from the microneedling won't be visible until it's like a delayed reaction. And I'm totally seeing that, because while I was microneedling, I thought I wasn't going deep enough because I felt numb. But now the redness is really showing. So yeah, and this area where I did 0.75 is really sensitive. Maybe I would go down to 0.5 instead, because the rest of my face is not sensitive besides this area under my chin. Maybe I didn't numb there enough. Anyway, I will leave the links where I got these products down below, and I will also link her video. I highly, highly, highly recommend you check her video out before you do, before you follow my procedure. I just wanted to show you the process, and I want to document before and after, but she has a really great protocol on like how to do it if this is your first time, introducing you to the products, introducing you to the safe techniques. So I will leave her link down below to the exact video that I watched, but she has so many other videos. She even has videos on like skincare to use after like your initial microneedle for like a whole month, and she like tells you when to incorporate new products, or like your retinols, your acids, like do not use those tonight. She even recommends that you just put the Cos de Baha serum tonight and that's it. But that's just way too drying for me. I cannot tolerate that. So I will leave her videos down below, and just explore, do your own research before you do this. But anyway, thank you so much for watching. If you have any more requests, please leave them down below. Thank you so much for watching. I think I've fanned my face enough. And maybe I'll see you in the next cut. Bye. So this is the morning after I microneedled. I microneedled yesterday at about 1:30 I finished. So it's been quite a while since I finished. I just wanted to show what my skin looks like. It's pretty even. It's looking plump. It's looking, there's a mirror here. I see a glow to my skin. There are a few clogged pores that I still have in this area, and I don't want to touch my face too much, but I think that's about it. Everywhere else on my skin, it's really smooth, and the same thing happened the first time I microneedled. I was redder the first time and a little bit more sensitive. My skin started peeling after about like 4 or 5 days. And then I know I shouldn't have done this, but I think I used Retin-A Tazarac about 4 days after I microneedled, and then I got like a texture reaction all over my face. There were bumps all over, and that obviously subsided, but afterwards it looked like I had a few pimples, and for future reference, I wouldn't do that again. But I did want to say that after that, with using the Biologique Recherche mist while I was microneedling, it didn't have any adverse effects on my skin. And I think that it was a good decision because it kept the hyaluronic acid moist, wet, without having to add so much more product onto the skin. And if you can find a mist that your skin doesn't react to and it's gentle, I highly recommend using that in conjunction with a hyaluronic acid, just to keep it moist, to keep it and to keep it gliding without skipping and dragging on the skin. What else can I say? I haven't washed my face since I microneedled, so yesterday afterwards I sprayed my face more with that mist, and then I put cream mask vernix from Biologique Recherche, and I highly recommend that mask. It's a mask that's suitable for like all skin types pretty much, but it really does help like eczema, dermatitis, any sensitivity that you're experiencing. The only problem is it doesn't have like humectants in it. It's kind of like an emollient and occlusive in one, so you need that hydration underneath prior to putting that on, because if you just put mask vernix on, you'll feel a little dry. You'll look glowy and your skin will just have like a beautiful texture to it, but you'll still feel a little like dehydrated. And I just reapplied that right before bedtime because I was feeling dry. Right now I'm still feeling dry, but it's not like too big of an issue. I would rather my skin feel this way than like me like put more and more and more on it and have the risk of irritating myself. But at this point, I believe if you have an oil that you want to use instead, or some kind of like gentle moisturizer, you can use that. I also used cream placenta right before bed because I felt that I wasn't getting enough moisture on my skin, and that was fine too. If you have that or another like cream from Biologique Recherche, I believe you can use that just fine. You won't have any issues, I don't think, especially with their biosensible range, meant for also sensitive skin types that I think would work really well. Or even mask biosensible. I think that would just be like perfect. So Right now, I have a sample of Masque VIPO2. I think I might put that on just to give my skin some nourishment. And the day after, I think you can possibly do something like that, but only with a mask that is nourishing for your skin, not anything. I wouldn't recommend anything aggressive on your skin at this point. It still feels tender, but not too bad because I didn't go as deep. If I went deeper, I would still only be using mask vernix. Just be aware, be cognizant of how your skin feels, and listen to it and treat it accordingly. So right now, I'm not feeling too sensitive. I'll go ahead and put Masque VIPO2 on from Biologique Recherche, just because I know that's a very gentle mask. I've had no reactions from it. If anything, sometimes I feel like it doesn't do much, but it still hydrates my skin. So that's what I'm needing right now. I need a little bit of hydration. So if you don't have that, you can also use your hyaluronic acid serum. Use kind of a lot of it, you know, the Cos de Baha that I showed. It's affordable, and then you can add in a little bit of your moisturizer in and kind of make like a thick mask, and you can put that on your face. Just have your mist handy and you can continue to spritz your face until your skin feels comfortable. And then once it dries down, you can just put a little bit more mist and a little bit more moisturizer on to just seal it all in if you're feeling as dry as I feel. But anyway, I really urge you to check out Penn Skincare. She has a ton of videos on protocols, Q&As, people asking a bunch of questions, and she gives her answers to them. And she has skincare that she recommends and loves using after her treatments. She's a really great resource here on YouTube, and she's an esthetician. She does this like every day in practice. So I really urge you to check her out if you haven't already. Thanks for watching. I'll see you soon. Bye.